Dr. Hamda Alnashmi graduated from Arab Gulf University in 2009, did her internship in Salmania Medical Complex. She has joined Psychiatric Hospital for her residency in 2011. She accomplished her Arab board in psychiatry in 2015. She holds 11 years of experience in the different fields of psychiatry and worked in mental health hospitals in different countries. She also happened to be a fine artist, first Bahraini fine artist to exhibit in the Louvre Museum in Paris. She is currently working in the King Hamad University Hospital, and she is a senior lecturer at RCSI. It's nice having you, Dr. Hamda.
Hello, good afternoon, everyone. Thank you for AGU for inviting me to be participating in this very important event. I will be speaking about my journey through psychiatry, and thank you for the introduction. I am an acting consultant of general adult psychiatry in King Hamad University Hospital, and I will be speaking with you briefly about my journey as an AGU graduate through my residency and till the moment. Yeah. Can I go for the slide? Yes. So I'll start my presentation today. First, am I visible? Because I cannot see myself, so. Anthony?
We could see your presentation, so it's
okay, sure. So I'll start my presentation today by remembering some of the old days when I was an AGU student during years 5 and 6, the final years. Like many of you, I started to have mixed feelings regarding future specialty. Going through the clinical rotations in Salmania Medical Complex and in BDF Hospital, I realized that a person builds a more clear and realistic view about his interest when they actually join the clinical rotation and deal with real patients. For instance, I remember when I was doing a musculoskeletal system rotation, I think, if I think correctly, it was in year 4 of medical school. I thought that I was fascinated by the anatomy and the cadavers and everything. So I thought I would go for orthopedic surgery, for example. But when in real life, when I joined orthopedic surgery rotation, it was in year 5, I realized for sure that I don't want to be specializing in anything that has anything to do with surgical rotations. So studying is something and then practicing is something else. There is a relation, definitely, but you will know your real interest once you put your hands on patients and you start treating and diagnosing patients. Okay, next slide, please. Yeah. So I remember during year 6, we had our psychiatry rotation. I joined one of the consultants and with my group of students. And that was the first time I observed a patient diagnosed as bipolar affective disorder, and he was in acute manic episode. I was fascinated by how the manifestations, like when you read them, you cannot imagine them, but when you see them, how they are in real life, you will be fascinated. It's like something I felt it's something outside this world. It is something that I used to see in movies, for instance, but I didn't believe that people could have those or could suffer from these symptoms. I also remember when I was in year 6, I attended hypnosis sessions with the same consultant, and I actually volunteered to have the hypnosis session. I did not believe that I could be, I could be under the influence of hypnosis, and we were actually joking about it. But when I volunteered and then and I had this experience, I realized that this science is actually true, and people could respond and be suggestible with the hypnosis instructions. I also attended as a year 6 student marital counseling with a psychologist in the psychiatric hospital. And I was amazed by how a total stranger, like this was my perspective as a young medical student. How could a stranger fixes or helps with a couple that they live together, for 10 or 15 years? So this also this aspect of psychiatry fascinated me, and made me have a clear view what I wanted to be specialized in the future. Next, please. Yes. And then we had the clinical attachment rotation. I don't know if they still have it now. It was between year 6 and year 5 back in my days. I did attend ECT sessions, electroconvulsive therapy. And again, I was fascinated by what I observed. I was, to be honest, I was scared in the beginning. But this is, I think, a general feeling to everybody who first joins the psychiatric rotation. But then when I observed how this treatment helps to be cured from long-standing psychiatric illness, I was again fascinated by how this treatment works with patients of mood disorders in particular. I participated as well in home visits, and this was totally new to me. I went to areas in Bahrain that I have never gone inside these areas. I didn't know these small roads existed, and I participated in patient care in their own homes, who had difficulties to reach the mental health facility. And I observed schizophrenic patients before and after treatment. How could the medication help with the negative and positive symptoms? So all this fascinated me. Actually, and it touched me a lot. I also attended forensic psychiatric clinic and observed many interesting cases. So by the end of clinical attachment, I had no doubts that I wanted to be a psychiatrist, and that was during year 6 of medical school in AGU. Next slide, please. I chose this picture because I really, I know a lot of you received already lectures about the internship and different experience during internship. I want to be optimistic in giving the experience, but also I want to be realistic. I think internship was the hardest phase of my medical career. I did my internship in Salmania Medical Complex. And during internship, yes, it's like you will have many milestones development during internship, actually, because you will be doing real work for the first time in your life. I think nowadays it's the training program is more organized than it was back in those days. But it was a tough experience. It's different from hospital to another, but having it in the most crowded hospital in Bahrain helped me to have a lot of good exposure and observation of many important cases. Next slide, please. Yeah. So I joined the psychiatric hospital. I had actually no doubt in what I wanted to be after the internship. And, after you pass your licensure, you will be having interviews for 3 of your specialties that you prefer to join. I remember I wrote in my paper psychiatry 3 times. So I was between either I have psychiatry as a specialty, either I join or I sit at home. So I had no second or third desire, to be honest. And I was accepted. It was 2011, and I joined the Arab Board program. It's a 4 or 5 years program, and I was enrolled in, as I said, in 2011, and passed my exams by 2015. So to enter, I'll speak a little bit more about the Arab Board in psychiatry, since this is my qualification. So to be eligible to enter the first part of Arab Board, you will have to work for 1 year in general adult psychiatry, and 2 years in general adult psychiatry, and then if you pass it, it's an MCQ exam, and it is usually held outside of Bahrain. Mine was in Jordan, Amman. And then when you pass it and you accomplish 4 years, the next 2 years of psychiatric rotation, you will have to go through child psychiatry, drug and alcohol, detox and rehab, old age psychiatry, liaison psychiatry, intellectual disability rotations, and community psychiatry, where you go and visit the patients in their own homes. So after you accomplish, and plus, of course, forensic psychiatry rotation. So after you finish all these rotations throughout 4 to 5 years, you will be eligible to enter the second part of Arab Board. And it is actually 2 parts. There's the first one, which is the MCQ, and the second one, which is clinical. And yes, I got my board certificate in psychiatry in 2000, by the end of 2015. Yeah, next slide, please. Yeah. So I worked for more than 6 years in psychiatric hospital, and I worked in Hamad Medical Cooperation, the mental health facility of Hamad Medical Cooperation in Doha. And then I joined KHUH as a general adult psychiatry from 2018 till the date. And through my modest experience in psychiatry, there is a difference in working in psychiatric hospitals versus in general hospitals. There is a difference in the nature of cases and the number of cases. For instance, you will see if you worked in the psychiatric hospital, you will be exposed to many of all mental illnesses. You will be exposed to all mental illnesses as a diagnosis and treatment, while in the general hospital, most of the cases, we call it a liaison psychiatry rotation actually. Most of the referrals will be from other specialties like medical and surgical, and as you all know, there is a strong correlation between medical illnesses and mental health. Plus we do review, because I'm working in KHUH, as you all know, we have the Bahrain Oncology Center, so we review all cases that suffer from oncology cases. So and most of the cases which attend the clinic, the mental health clinic in KHUH, are anxiety disorders, PTSD, OCD, panic disorders, depression, somatization disorders, hypochondriasis, which is having the strong belief that you have a mental illness, that you have a physical illness that was not diagnosed. This is the bulk of cases that we get in the general hospitals. Next slide, please. Yes, I'll end my presentation by explaining the following for the students who wish to become psychiatrists. So if you have the ability to be a good listener and to be a person who reads between the lines, and as you all know, in psychiatry and mental health, we don't usually have a diagnostic tool like most of the other medical specialties. There is no test or a lab test or any imaging that helps you with diagnosis. So you have You have to be broad in your way of thinking. And as you all know, as I hope you all know, in psychiatry, we have overlap of symptoms. For instance, we have patients with poor concentration, for example. This is their main issue. Poor concentration could be a symptom of mania, of hypomania, of ADHD, of depression, and it could be also a normal variation. So we have to bear in mind that we have to put all possibilities when we diagnose, and we have to be always empathizing with patients, because we don't deal with an illness, we deal with the lifestyle of a patient, we deal with their feelings. So a psychiatrist must be a person who's compassionate, patient, and accepting all people without judging and without pre-assumptions. So that was my presentation, and I open the floor for discussions or any questions.
Thank you, Doctora. Actually, I have one question, if you don't mind. I remember those old years when I used to study in AGU, and I had some interest in reading philosophy, and I was fascinated about ideas. And one of my senior colleagues, he told me, "Why you don't go to psychiatry?" So now I'm now far away to go start my career in psychiatry for sure. But just I'm asking you, do you think that if a student has that interest in reading in philosophy or reading in ideas, do you think that this will help him to be a very successful psychiatrist in the future, or do you think it's totally different pathway?
Definitely. Psychiatry is a special field of medicine where you have to be educated in many aspects, especially philosophy, social aspects. You know, the major difficulty we face even now till these days is the stigma of psychiatric illness. So as a good psychiatrist must be a person who is always aware of what's going on, and you cannot just be focused on the medical field or the medical aspect of psychiatry and forget all the other aspects, because as I just mentioned, we don't deal with illness, we deal with human lives in psychiatry.
Thank you, Doctor. Thank you so much.
Is there any questions? You may ask in the chat, please. Thank you so much, Dr. Hamda. It was nice having you with us today.
Thank you.
There is one question in the chat, Dr. Hamda. Thank you very much. This is Dr. Munariqat. There's a question that says, how can psychiatry not affect our lives?
Well, to be honest with you, it does affect our lives tremendously, actually. But, you know, with experience, you will be building it's like a transparent shield. But still, you know, as from my personal point of view, mental illness is very easily treatable, but we cannot treat as catastrophic events that a person lives and it touches them from inside. Like, for example, some cases that usually we will be affected by them, like child abuse cases, pedophilia cases, crimes. So yes, but again, with experience, we usually become stronger in protecting our own mental health as psychiatrists.
That was an excellent question, to be honest. We always ask ourselves, psychiatry will affect our future. But thank you, Doctor. Thank you so much.